Hi, welcome to Xtremities. We're going to give you a piercing video today. We're going to be doing a dermal. This is our piercing room. We're going to do a piercing on a friend of ours named Sonia. Sonia's going to get a dermal on her hip. This is a re-pierce on her hip because she scratched it out. So we've done a few things. The scar's in good condition. It's ready to be re-pierced, so we're going to go ahead and do that. First thing I think we're going to do is show you how we're going to set up for the piercing, and then we're going to let you talk to Sonia after that. Now what we're going to do is we're going to set up for this piercing. Now remember, it's a dermal piercing, so as I go through, I'll be showing you what I'm going to do. First we're going to put down a dental bib. We use these all the time. This coats our tray. It's just part of the sterilization process, and it keeps any contamination from crossing over. We're going to be using a dermal punch. We're going to put down some lubricated gel. The purpose of the gel is to make sure that the insertion of needles and jewelry go very smooth for her. We're going to put down an alcohol swab or two. And we're going to use something called BCK to sterilize and clean the area that's going to be pierced. Then what we're going to do is we're going to pick some jewelry. So in our cabinet here, we're going to pick a dermal piece. And I don't know if you can see that, but you can cut it later. That's what we're going to use. We're going to put out a needle for this. Right here. So just so everybody knows, all of our needles, all of our dermal punches, everything we use like that is pre-sterilized. It's a single only use. It goes into one of these sharps containers and is picked up by the region of peel or one of the people that they like.
Hi, my name is Sonia, and today I'm here at Xtremities to redo my dermal that Steve is going to be doing for me. Steve only does my dermals. What happened was I was sleeping, and in the midst of my sleep I was scratching the side of my hip, and I woke up in the middle of the sleep remembering my nail getting caught under the jewelry, and I opened my eyes and I flipped on the light and I looked and half the plate was sticking out. So I knew that at that point I had to take a picture and send it, and now it's healed and ready to get redone.
Okay, the first thing we're going to do is we're going to clean and mark the piercing. This is called BZK. And really what it does is it just cleans up the area to make sure there's nothing on there that's going to give her any kind of soreness or infection later. And then we're going to make sure that the BZK is removed by using some alcohol. We're just going to let that dry for a second, and then we're going to give it a marking. So stand with your hands at your side and look straight ahead. Don't stand at attention, just be comfortable. And we're going to give this piercing a marking right here. And we're going to check to make sure that marking is even with the other one on the other side. And it looks pretty even to me. So the next thing we're going to do now is we're going to get Sonia ready for the piercing. We're going to get her lie down on the piercing. Okay, so what we're going to do here is we're going to grab a hold of some tissue, and we're going to try and keep a hold of the tissue. And what we're going to do, the reason for that is it's going to prevent a lot of bleeding from going on. So the first thing we're going to do is we're going to make a hole with a dermal punch, and I'm going to give Sonia some instructions on how to breathe, okay? So keep your eyes closed. When I tell you to breathe into your chest and hold it. When I tell you to breathe it all out at one time, okay? Okay, breathe in and breathe out. So that was pretty easy. Now we're going to make a secondary insertion for her. It's very important that we keep the right angles on all of these. Makes life much easier. So we've done that. Now we're going to take the jewelry, try and slide her in. Once it's in, unclamp, have a look, and that's a perfect dermal. Once the dermal's done, we like to put a little bit of pressure on it for a minute or two, make sure that it's not going to bleed, and we're all done. Breathe normally now, and just chill out. And that's a dermal. 2 or 3 minutes, I'll let you take a look at it and see what it really looks like, but that's pretty perfect dermal. When we're done, we're going to put a bandage on it. So we're finished the dermal. Do you want to get up and have a look at it? So those are pretty perfect. We've done all those dermals over a couple of months.
Yes.
So they're pretty nice.
Yes. You've done all of them. Steve has done all of my dermals. And no pain, no gain to look like this.
So at the end of the service, what we're going to do is we're going to make sure we dispose of everything correctly. This is the clamp we used in order to hold her jewelry. We're going to make sure that goes into a tray. That jewelry, those implements will later go into a ultrasonic container with an antibacterial bath. When that's done, they'll get rinsed and then they'll be packaged up and they'll be put into a sterilizer. Our sterilizer is checked by a laboratory every 2 weeks. The needle will go into a sharps container. This sharps container is picked up by a laboratory about once a month and disposed of properly. And when we're wrapping up the container, we're going to roll everything up and we're going to place it into the gloves, and then again stops a whole bunch of cross-contamination from happening.